I wanted to first thank Chris for putting this special issue together. When she reached out to me, she told me, said like, Vikas, you've been actually working in this area for a long time. So I went back on my resume and I looked at all the papers that I had worked in healthcare, and I realized I actually had been working in healthcare for a long time. What I did is I just took a few of them, which I thought that if I had written them today, I would have definitely submitted them to this special issue. And I want to kind of highlight the relevance of this, and I want to take a couple minutes then to touch on some learnings that I got from working in healthcare, right? So if you go to, for example, the 1998 paper, so this is the similar kind of data set that you were highlighting. What we showed over there, that patients having negative experiences have a much bigger impact on utilization and overall quality and overall assessment than positive. So this is the familiar prospect theory type stuff, right? If you look at the 2006 paper, which I thought was so relevant then, and it's so relevant today, when patients in nursing homes get pressure ulcer, what happens is when you develop a pressure ulcer, your skin first turns black and then it lightens up. So the implication of this is pressure ulcers are extremely difficult to detect in African Americans than they are among Caucasians, right? And there is no methodology to do that. And a simple methodology where you take like a flashlight and run it over the skin where pressure ulcers develop, which is typically the elbow or joints. Doing that, we showed that you could reduce pressure ulcers by 85–90%. And each, a nursing home could save well over $10 million just a year, right? So if we look at, so for example, the 2008 paper, this was in IGRM, and one of my students worked with the California hospital system to figure out that if you live in like a, so this is, something that John also brought up. If you live in like a poor community, and Len brought up, you don't have that much ambulance care available, right? So if patient has certain conditions and they have to be rushed to a hospital, it takes longer for the patient to get to to a hospital. And the paper basically looked at a model to figure out where should the next hospital be placed to increase, better reach for emergency care to poor patients, right? 2009 paper, okay, this is actually with Pinar when she was a PhD student at Pitt, and she was in industrial engineering, and she came to me and I said, no, Pinar, you need to be in marketing, and this was a paper we wrote. So I was the only marketing person. Larry Brown was the, VP of distribution. Pinar was the operations person, and all the other professors were from operations, and basically it showed how could GlaxoSmithKline increase service quality through placement of distribution centers. And, I especially want to highlight the last two 2020 papers. So 2020 paper builds on a similar kind of issue that Len Berry touched on. So these are what we call difficult decisions, right? So a patient has, doctor feels that the patient should be, given more treatment, and the family wants to put them on palliative care, right? So this is an ethical dilemma, and doctors are not really trained to resolve these dilemmas. And this paper looked at, all hospitals have ethics committees, and how should doctors approach the ethics committee? And what is the consequence of approaching an ethics committee to improve outcomes for patients, right? And I think like ethics is a completely untouched area within marketing, especially in the context of healthcare. And the 2020 paper, my co-author Hari will talk about it. It's a paper in terms of liver cancer care. And I want to highlight the best thing that came out of this. My daughter got interested in this, and she now has 2 papers on this area. And she's an undergraduate at Rice. So this is very important for me, right? So Chris, if you can move to the next slide. Chris, yeah. So I just want to highlight 2 things in here. I think working with healthcare folks, what I have learned is one thing is, they are more interested in problem solving and practical relevance. So in a healthcare paper, they typically will have a huge first paragraph that tells why this problem is important. And they are not really interested in, laborious, like, thin theory testing, mediation, and all of that. So we need to be mindful of that. I think the second issue, which I find is very important, they are not interested in having marketing theory. They want to know how a marketing perspective can help them solve their problem, right? And I think if we decide that we are going to work with a non-marketing scholars, we need to be mindful of learning their incentive structures, right? So I will stop here. And the third slide basically talks about some ways it can benefit us personally in working this. It helps with research, it does help with teaching, and it helps with career. For me to be a faculty at UPMC and Baylor College of Medicine throughout my career has been very rewarding, in addition to being a marketing professor.